Tuberculosis, or TB, is back. It's a leading infectious disease killer. In fact, it surpassed COVID-19 in 2023. This is a global health crisis. The numbers tell a stark story. In 2023, there were 8.2 million new cases of TB. Tragically, 1.25 million people died from this preventable disease. Certain countries bear a heavier burden. India, Indonesia, China, the Philippines, and Pakistan account for over half of all cases. This highlights the unequal impact of TB around the world. The resurgence of TB is a wake-up call. We must act now to control this deadly disease and prevent further suffering. Multi-drug-resistant TB, or MDR-TB, is a serious concern. This type of TB doesn't respond to standard treatments. It's harder to treat and can be deadly. The good news is that new treatments for MDR-TB are showing promise. These regimens are shorter and easier for patients to tolerate. One such regimen is the BPL regimen. It combines 3 drugs, bedaquiline, pretomanid, and linezolid. Early results suggest it is highly effective. However, access to these new treatments remains limited. Many countries lack the resources to provide them widely. Fighting TB requires significant financial investment. Sadly, global funding falls far short of what's needed. In 2023, only $5.7 billion was available, a fraction of the $22 billion target. This funding gap has dire consequences. People with TB often face catastrophic costs for diagnosis and treatment. They may have to sell possessions or go into debt to afford care. This financial burden can be devastating, pushing families deeper into poverty. It also creates a barrier to accessing treatment, allowing the disease to spread further. TB is more than just a medical problem. It's a social and economic problem too. Factors like poverty, malnutrition, and poor living conditions increase the risk of infection. Other risk factors include HIV infection, smoking, and diabetes. Addressing these underlying issues is crucial to controlling TB. We need a multi-sectoral approach. This means governments, healthcare providers, and communities working together. Investing in TB research is also vital. We need new tools to diagnose, treat, and prevent this disease, including more effective vaccines. The fight against TB is far from over, but with increased funding, political will, and global cooperation, we can turn the tide.